I call on Nicola Sturgeon, First Minister.
Thank you, Presiding Officer. I'll give an update today on COVID generally and also the latest data on Omicron. I'll report on progress with booster vaccinations. I will again appeal to everyone across the country to reduce contacts and stay at home as much as possible in the run-up to Christmas Day and then again after this Christmas weekend, and also reiterate the steps we can all take to make family celebrations this weekend as safe as possible. I'll also confirm Cabinet's decision to propose some additional protections in relation to large-scale live events and indoor public places. We judge these to be necessary to further slow the spread of the virus so that we can protect health, the National Health Service and the economy as we work to complete booster vaccinations. And I'll set out further support for the many businesses affected by the advice we feel duty-bound to give in the interest of protecting public health. First, though, today's statistics: 5,242 positive cases were reported yesterday, at 14.9% of tests carried out. 515 people are in hospital with COVID, one fewer than yesterday. 37 people are in intensive care, also one fewer than yesterday. And sadly, a further 9 deaths have been reported, taking the total number of deaths under the daily definition to 9,790. And I want again to send my condolences to everyone who has lost a loved one. Presiding Officer, in last week's statement, I reported that cases had increased by 25% in the preceding 7 days, and that we would, in all likelihood, see a further increase in infections as Omicron became the dominant strain circulating in Scotland. Omicron has now firmly established itself as the dominant strain. We know from the S-gene dropout indicator that it now accounts for 62.9% of all cases. That's compared to 27.5% this time last week. Omicron is significantly more transmissible than previous variants, and we estimate its R number is well above 3. It is currently spreading rapidly across Scotland, and so the steep increase in infections that was predicted last week has now started to materialise. Cases increased by more than 50% in the past week, from over 3,500 a day on average to almost 5,500 a day. There were increases across all age groups, but the biggest, an increase of 161%, was in the 20 to 24-year-old age group. The rate of acceleration in an age cohort with, to date, lower levels, relatively speaking, of booster protection underlines the vital importance of everyone getting booster jags as quickly as possible, and I'll return to that later. However, as the booster rollout is completed, and bearing in mind that it takes around a week for immune protection to take effect in individuals, we must also act to slow down the spread of cases. And I want to explain why that is so vital. Firstly, the toll that a rising wave of infections will have on health and social care is considerable. We don't yet know if the proportion of Omicron cases needing hospital care will be lower, higher or the same as with Delta. However, there's still no compelling evidence that Omicron is intrinsically milder than previous strains. However, even if the proportion of cases needing hospital care is lower, as we hope it will be, a smaller proportion of a much larger number of infections will still have a deeply damaging impact. As well as the suffering caused to individuals and families, the additional pressure on our already stretched National Health Service will be extremely difficult to manage. In addition to that, if large numbers of people become infected, even mildly, the impact on the economy and critical services through sickness and isolation absences will be crippling. Indeed, we're already starting to see this impact. 100 ScotRail services were cancelled yesterday due to staff absence. Theatres are already being forced to cancel shows due to COVID cases amongst cast and crews. And even more seriously, staffing shortages are already being felt across the supply chain, and they are exacerbating the intense pressures that the NHS and emergency services are working under. So this is why we must act, and let me be clear again, this is not a choice between protecting health and protecting the economy. If we don't stem the spread of the virus, both health and the economy will suffer. Now, before I set out the action we must take, let me address one further point. Some ask why we can't wait until we have more data and know exactly the impact Omicron will have on the NHS. I totally understand the temptation to delay. to hope, after 2 long years of this, that further steps might not be necessary. But firstly, as I said a moment ago, we are already seeing a significant impact from staff absences across the economy and public services. We must do what we can to stem this. And secondly, we know from experience that if we wait until the data tells us conclusively that we have a problem, for example, with hospital admissions, it will already be too late to act to avoid that problem. We must act quickly insofar as we are able, given our financial constraints, and we must get ahead of the data if we can. So the obligation of government is to take difficult decisions to keep the country as safe as possible, no matter how unpopular these decisions might be. So let me now set out the steps we all need to take. Firstly, though, let me stress we are not changing the advice for Christmas that I set out last week. It is important that with just a few days to go, there is certainty about family gatherings on Christmas Day and Boxing Day. I am not asking anyone to change these. However, and I can't stress this enough, please do follow advice to keep family celebrations as safe as possible. Keep gatherings as small as your family circumstances allow. Make sure everyone does a test shortly before getting together. Anyone who tests positive should not mix with others. And given how infectious Omicron is, you should assume that if one member of a household is positive, the others are likely to be so too. Follow hygiene advice and keep windows open. And crucially, between now and Christmas Day, cut your contacts with people in other households as much as possible. Minimise socialising with others, either at home or in indoor public places. Indeed, stay at home as much as is feasible. This is the best way of avoiding getting COVID and having to isolate over Christmas, or inadvertently spreading infection when you do meet up with others. I'm really grateful to everyone who has followed this advice over the last week. It will be making a difference, and I want to stress this point. The steep increase in cases over the past week would have been steeper still, but for people complying with this advice. So I hope we may already be collectively slowing the spread. But it is important that we stick with it. So my first new request of everyone today is this. From the 27th of December, as we come out of the Christmas weekend, and at least until the end of the first week in January, when we will review this advice again, please go back to limiting your contacts as much as you possibly can. Please stay at home as much as is feasible. When you do go out, maintain physical distancing from people not in your own group. And difficult though it is, please follow this advice over New Year. Minimise hogmanay socialising as much as you can. If we all follow the advice to minimise the contact we have outside our own households, we will help limit the spread of infections. So this is the bedrock of our plan for the immediate period ahead. However, while our core advice is to reduce socialising and stay at home as much as feasible, the Cabinet's judgment is that we must also take some further steps to make the places where people might still gather as safe as possible. And that is why we are proposing some additional protections. None of these are being proposed lightly, but we do consider them necessary to help stem the increase in cases, safeguard health and protect the NHS, the emergency services and the economy while we complete and get the full effect of the booster programme. So first, from the 26th of December, inclusive of that date, for a period of up to 3 weeks, we intend to place limits on the size of live public events that can take place. This does not apply, let me stress, to private life events such as weddings. For indoor standing events, the limit will be 100. For indoor seated events, it will be 200. And for outdoor events, at 500 seated or standing. Physical distancing of 1 metre will be required at events that go ahead within these limits. This will, of course, make sports matches, including football, effectively spectator-free over this 3-week period, a situation similar to that in Wales from Boxing Day. And it will also mean, unfortunately, that large-scale hogmanay celebrations, including that planned here in our capital city, will not proceed. I know how disappointing this will be for those looking forward to these events and for the organisers of them. But I want to underline why we think this difficult decision is necessary. Firstly, we know that the much higher transmissibility of Omicron means large gatherings have the potential to become very rapid super spreader events, putting large numbers at risk of getting infected very quickly. Limiting these events helps reduce the risk of widespread transmission. It also cuts down the transmission risks associated with travel to and from such events. And second, and this is not an insignificant point. These large events put an additional burden on emergency services, especially the police and ambulance services, at a time when these services are already under severe pressure and also dealing with high staff absences. Limiting large-scale events will help them focus on delivering essential services to the public. So I would ask the public, despite the disappointment I know this decision will generate, to please understand the reasons for it. Second, we intend to issue guidance to the effect that non-professional indoor contact sports for adults should not take place during up to a 3-week period from 26 December. This is because these activities where physical distancing is not possible also create a heightened risk of transmission. And finally, from the 27th of December, again for up to 3 weeks, we intend to introduce some further protections in hospitality settings and other indoor public places to reduce transmission risk in what are, through no fault of those who run such venues, higher risk environments. I can confirm that a requirement for table service only will be reintroduced for venues serving alcohol for consumption on the premises, and we will also ask indoor hospitality and leisure venues to ensure 1 metre distance, not within but between groups of people who are attending together. And we will continue to advise, as I set out last week, people that if they are attending indoor hospitality or leisure venues, and remember our core advice remains to minimise this, there should be no more than 3 households represented in any group. Presiding Officer, I know how unwelcome this will be for everyone, but we believe these precautionary steps will help us navigate a difficult period more safely. I'm also acutely aware that these decisions and the advice we are giving the public have significant financial implications for many businesses. Last week, I announced £100 million of support from within our existing resources for affected sectors. I can also confirm eligibility and guidance for the hospitality sector will be published on the Scottish Government website today. Since then, the Treasury has given approval for money that would have come to us later to be allocated now. As I have said, we had already budgeted for most of that money, and so we cannot allocate it now without causing significant shortfalls elsewhere, including in the health budget. Money simply cannot be spent twice. However, we estimate that the Treasury announcements do give us additional spending power now of £175 million, and I can confirm today that we will allocate all of this to business support. The Treasury has also, in the last hour or so, announced additional funding for business. Unfortunately, it would appear that this announcement generates no further funding for Scotland and that any consequentials are already contained within previous announcements by the Treasury. I can, however, announce that the Scottish Government will allocate a further £100 million from elsewhere in our budget between now and the end of the financial year. This will involve really difficult decisions, but the impact of the current crisis on business is such that we consider it essential. So taken together, this adds up to a fund of £375 million that will help support businesses for the unavoidable impacts of our decisions over the next 3 weeks. This is significantly more proportionately than the Chancellor has just announced for businesses elsewhere in the UK. Presiding Officer, while this is significant funding, I understand that it will not fully compensate business. As I said last week, my view is that the scale and urgency of the Omicron challenge requires financial support for business on a scale similar to that at the start of the pandemic. However, current UK funding arrangements mean, firstly, that only the Treasury has the borrowing powers to provide support on such a scale, and second, that financial support at scale is triggered only when the UK Government takes decisions for England. All of this means that our ability to act to protect public health and to compensate individuals and businesses affected is curtailed. This cannot be right in a public health emergency. So while today's Treasury announcement may be a welcome acknowledgement of the crisis businesses face, it does not yet go far enough. We will therefore continue to press the UK Government to take the threat of Omicron more seriously and to act accordingly. But in the meantime, we will, indeed we must, live up to our own responsibilities to do everything we can to protect health, lives and livelihoods here in Scotland. Presiding Officer, before I conclude with an update on vaccination, let me cover 2 further points. Firstly, it remains our priority, I hope Parliament's priority, to reopen schools as normal after the Christmas holidays. Indeed, one reason for asking adults to make sacrifices for a further period after Christmas is to help minimise any impact on children's education. However, to help ensure that schools are safe environments for young people and staff, updated guidance based on recommendations from the Education Advisory Subgroup was published at the end of last week. Colleges and universities are also assessing any steps they need to take for the new term, and some are returning to a default model of online learning for the start of the new term. For everyone involved in education, staff, children, students and parents, this has been another exceptionally difficult term, and I want to say a heartfelt thank you to all those who have helped ensure that children have been well supported, and indeed to children and young people themselves for the tough times that they continue to endure at such an important stage of their lives. Second point I want to cover briefly relates to Test and Protect. The current surge in cases is putting significant pressure on Test and Protect, and I'm grateful to all of its teams for working so hard to help break chains of transmission. From this week, Test and Protect will flex its approach as necessary to ensure priority is given to higher risk settings such as hospitals and care homes, where outbreaks can cause most harm. For many of us, this means that if we test positive, our contact from Test and Protect teams is more likely to be by text or email rather than phone call. Please make sure you respond to these messages and complete the online form that is sent. This helps your contacts get the right advice as quickly as possible. And if you are the contact of someone who tests positive, please follow Test and Protect advice. This will help slow the spread of the virus. Let me turn finally to booster jags, which are, of course, our best line of defence against Omicron, and they are what will get us through and out of this difficult phase, I believe. There has been a significant acceleration of the programme in the past week, and I thank everyone involved. A further 2 large-scale vaccination centres have opened this week at Hampden in Glasgow and at the Edinburgh International Conference Centre. Yesterday, 69,135 boosters or third doses were administered. That means well over half now of the adult population has had a third dose or a booster. Last week, I said that our target was to have 80% of the eligible population vaccinated with boosters by the time the bells strike on Hogmanay. I can confirm today that we are now confident we have the capacity to meet that target. But of course, to reach it or get as close to it as possible, we need everyone who is eligible to come forward. So if you have an appointment booked for January, please now reschedule it for December. Appointments will be available right through Christmas Eve and then next week up to and including Hogmanay. So please book an appointment now. Alternatively, check out the location of drop-in clinics and go there instead. Getting fully vaccinated is the best thing any of us can do to protect ourselves, our loved ones and the country. So please do get boosted before the bells. Presiding Officer, this statement in some ways feels distressingly similar to the one I gave this time last year. Just a few days before Christmas, I'm again urging people to stay at home as much as possible to slow down a highly infectious new variant of COVID. But although it might not feel like it, we are in a much stronger position than last year. We have had far fewer restrictions in place for much of this year than was the case in the previous year. Christmas Day this year will be more normal than last year. Most importantly of all, a rapidly increasing number of adults is now protected by 3 doses of vaccine. And all of us as individuals know what to do to protect ourselves and each other. So please make sure you do all of these things. First, get fully vaccinated as soon as possible. Second, test regularly. Our advice, of course, is to stay at home as much as possible. But if you are meeting other people, test before you go every time and test as close to going as possible. And this is really important, of course, for family gatherings on Christmas Day or Boxing Day. And finally, take all the other precautions which can help to make a difference. Work from home when possible. Stay at home as much as you can. If you do visit indoor public places, limit the number of households in your group to a maximum of 3. Wear a face covering on public transport, in shops and when moving about in hospitality, and make sure the covering fully covers your mouth and nose. Keep windows open if you are meeting indoors, even at this time of year, and follow all advice on hygiene. Sticking to all of this is really hard, but there is no doubt whatsoever it will help keep all of us safer. So I want to end this final statement before Christmas, Presiding Officer, with a heartfelt thank you to everyone for everything you have done to help us through another exceptionally tough year. I wish everyone the happiest and safest Christmas possible, and of course a much better and brighter new year ahead.
Thank you. The First Minister will now take questions on the issues raised in her statement. I intend to allow around 40 minutes for questions, after which we'll move on to the next item of business. And I'd be grateful if members who wish to ask a question were to press the request to speak buttons now. And I call Douglas Ross.
Thank you, Presiding Officer. We're once again facing the unwelcome reality of this new variant and new restrictions. And everyone in this chamber has to understand and accept the frustration and anger that people across Scotland are feeling right now. But we can get through this. And like the First Minister, I want to encourage everyone to go out and get their booster jab. I've got my own scheduled for Christmas Eve. But I also want to say to a proportion of the population out there that we often focus solely on booster jags, but there are people who have not yet had their first jag. And I want to encourage them to come forward as well. They haven't left it too late. There is no shame turning up to get your first jag now. The vaccinators simply want to protect you. So please consider doing that as well. And it is our vaccination scheme in Scotland and across the UK that has helped to keep COVID under control, and it remains our best way out of this. And it's absolutely crucial that we see the Scottish and UK governments working together constructively, fully focused on Omicron. Instead, sadly, over the last week, we've seen an unnecessary funding row that is a distraction to the task at hand. The Scottish Government originally expected £268 million, which would have still been new money, but they've now been provided with £440 million. As the Institute for Fiscal Studies made clear yesterday, this £440 million is extra money now. The Scottish Government has the funding available and Scottish businesses are crying out for it. The First Minister said this last week: businesses are already bleeding, every 24 hours counts. So will the First Minister tell us today when the first grants will start to reach businesses? Will it be before Christmas or will it be into the new year? Secondly, the First Minister explained in her statement that 100 ScotRail services have been cancelled due to staff absences, and there are similar pressures on our emergency services and others. We raised concerns last week that self-isolation guidance for household contacts would lead to these challenges. And while well-intentioned in seeking to limit the spread of the virus, the rules could grind our transport network, our economy and public services to a halt. So given that the evidence is now showing the impact of these rules on our essential services, can the First Minister tell us if she's considered changing these rules so household contacts can end self-isolation if they have a negative test? And if not, is she confident this position is sustainable for our economy and our public services?
First Minister.
Thank you. I'll take each of these points in turn. Firstly, can I take the opportunity to agree with Douglas Ross about the importance of, if you haven't already had your first or second jag, to get those jags as quickly as possible. It is never too late, so come forward now and you will be vaccinated. And of course, the sooner you get your first jag, the sooner you'll get your second jag, and then the sooner you will also be able to get the protection of booster vaccination. So that is a point I will reiterate and underline. Secondly, in terms of the funding, look, I'm not trying to cause a row with anybody. There are structural problems in how our funding arrangements work. We have different views across this chamber on the Barnett formula, and I'll leave those to one side. But I think what we've learned during a public health emergency is the Barnett formula is not fit for purpose, and that's a view I think shared by the government in Wales and Northern Ireland. So we're trying to propose constructive ways of making sure that all of us are able to discharge our public health responsibilities fairly and equitably. I welcome the announcements that the Treasury has made. The money that was announced this time last week is not new money. It is already budgeted for, largely for the health budget. So to spend it now, we have to remove money that the Health Service is already planning to use. The announcement made on Sunday, we think, gives us extra spending power now, money that's not already budgeted, and I'm saying today we will allocate every penny of that to business support. And between my announcement last week and my further announcement today, we will find, through very difficult budgetary decisions between now and the end of the financial year, an additional £200 million. That means that we are creating a pot of money to help businesses over the next period of £375 million. That is proportionately, significantly in excess of the £1 billion for the whole UK that the Chancellor has announced today. These grants, the grants based on my announcement last week for hospitality, is up to £6,800 per hospitality business. That compares to up to £6,000 announced by the Chancellor today. We are working to get those grants to businesses just as quickly as possible, and we're working with councils to do that. Finally, Presiding Officer, on self-isolation. I mean, this is an important point, and it is one that is under ongoing consideration by the government. But the fundamental point I need to make is this: it's not self-isolation that is creating staff absences, it's the virus that's creating staff absences. And given the infectiousness of Omicron, if at this stage we don't have households isolating when one member is positive, we will have many more cases of the virus spreading, and we will compound, not alleviate, that problem. So that's the position right now, but we know and we want to migrate to something more proportionate as quickly as possible. So I can tell the Chamber that the Government is actively considering, as the booster programme meets its target, moving away from the current situation to something more proportionate. But it would be counterproductive to do that right now, because the household isolation policy at the moment remains one of the protections we have in place.
Anna Sarwar.
Presiding Officer, can I start by sending my condolences to all those that have lost a loved one. I was fortunate enough to get my booster yesterday, so can I thank Zara and all our vaccinators for their extraordinary efforts. And I appeal to people across the country: if you haven't had your first or second dose of the vaccine, please do. And if you're due a booster, then please book it. And as we head towards Christmas, I would also ask everyone to please wear a mask where appropriate, follow the advice, and also please take a lateral flow test before meeting others. This is about protecting you, your family, and those around you. This is a time of anxiety for people worried about their lives and livelihoods, especially for those in the hospitality, events and leisure industries, as well as the self-employed. And people will expect and need the Scottish and UK governments to work together in the national interest at this time of crisis. Now, I note the announcements of the Chancellor today, but they simply don't go far enough. There must be an increase in the level of statutory sick pay. There must be much more significant financial support for impacted businesses and the self-employed, and for the sectors that are shut down or as good as shut down, a furlough type scheme, so we don't have businesses going bust and thousands becoming unemployed. And here in Scotland, there was believed to be around a 4,500 limit that businesses could apply for. I think the First Minister was suggesting that that perhaps will be increased to 6,800. But for many businesses, that will go nowhere near covering the impact of the losses they will face over Christmas. Also, no one should have to think twice about self-isolating due to financial pressures. Last month, 30% of people's applications for a self-isolation grant were rejected. That has peaked at as much as 50%, and with some local authorities, that's gone as high as 70% of applications for a self-isolation grant rejected. Can this be urgently reviewed? All the data published for every local authority, the eligibility criteria expanded, and the payment made much quicker. Now, finally, of course, we hope that this is the last variant, but it's highly likely that it won't be. So we must learn the lessons of Delta and Omicron. We need to build resilience and contingencies in our public services and the wider system. The Scottish and the UK governments must develop a framework and triggers for when restrictions will kick in, what they will be, and what financial package of support will come with it. So will the Scottish Government commit to urgently starting that work? And that is something that we will commit to engage with them actively on, because the ongoing uncertainty only adds to the level of anxiety and impacts negatively on people's health and well-being.
First Minister.
Again, thank you for those questions. I agree about the importance of the Scottish and UK governments working together. I think in many respects we have been and continue to work well together. In the past week and a half, I have taken part in 3 COBRA meetings. We have regular Four Nations discussions over and above that. We have an issue with financing that we cannot unilaterally resolve, and Anna Sarwar has narrated much of it today. And the points I make in this chamber are almost identical to the points Anna Sarwar's Labour colleague Mark Drakeford is making in Wales. So we cannot unilaterally resolve these, but I hope we will get movement to find better ways forward on this. We will, after the announcements I've made today, we will have further consultation with businesses to see what additional support can be made available from the additional funding, and what way it is best to make that available in. We have already given commitments to hospitality and other sectors. The additional money I'm announcing today will allow us to go further. But I agree, indeed I said it myself in my statement, it will not fully compensate businesses. That's why I think there should be the reintroduction at this stage of at least a targeted furlough scheme in order to help the most affected sectors. So we will do everything we can within our own resources, and we will work with colleagues in Wales and Northern Ireland to try to get more support from the UK government. I will again take away the points on self-isolation grant. I accept the premise of that question, but again, I come back to the fact we have a limited pot of money, and so we have decisions to make about whether we try to focus that money on those most in need or spread it more thinly over a wider range of people by extending eligibility criteria. That's not an easy balance to strike, but we've put an extra £100 million into self-isolation grants, so we will again consider that. Lastly, Presiding Officer, we've already started work on longer-term health resilience, not just